Good evening. Can folks hear me? My name is Evelyn Liebman. I'm the AARP New Jersey Director of Advocacy, and I will be your MC for this evening's rally. Thank you all so much for attending. Like so many things during these times, a virtual rally is a first for us and maybe for you. Thank you for being here. Thank you for all you are doing to keep people safe during this unprecedented pandemic. And thank you for everything you are doing to prevent the loss of lives in our long-term care facilities. We have gathered here tonight to take action. Before we get started, I just want everyone to know that this call is being recorded. There are also reporters on the call, so it's possible you may be quoted if you choose to share a personal story. And before we get started, I just want to share some Zoom meeting tips for tonight's rally. Larry? To change your display name, after entering the Zoom room, click on the Participants button at the top of the Zoom window. Next, hover over your mouse over your name in the participants list on the right side of the Zoom window. Click on Rename, enter the name you'd like to appear in the Zoom room, and click on OK. During this Zoom rally, your microphone will be muted until you are invited to speak. We invite you to have your video on so everyone at the rally can see one another. The chat box will be limited to private messages to the hosts of the Zoom meeting. I'll go over this in more detail in a few minutes. And if you are being asked to share your personal story live, you will be prompted to click "Host would like to unmute you." You'll see that message on your screen. Please click the blue button to unmute yourself. Finally, we suggest keeping the Zoom meeting layout on speaker view versus gallery view. You can find that button in the upper right-hand corner of your screen. We know that many of you attending tonight are likely caring for a loved one while they are at home or in a nursing home or in another type of long-term care facility. So before we begin tonight, we want to take a moment to thank you for your selfless work caring for our loved ones. Larry?
Hey Dad, just checking in.
Okay. Okay.
Okay. Okay.
Hi, Mommy. How does the mask fit?
Great. It's good.
Hola. ¿Estás tomando café?
You make me happy when skies are gray.
Love you. We miss you. How you feeling?
What a beautiful baby.
Thank you again to all of you caregivers out there for all of the selfless work you do. We're here tonight because at least 68,000 people living and working in nursing homes and other long-term care facilities have died from the coronavirus around the country. More than 40% of the US coronavirus deaths are linked to nursing homes. And we know that this just has to end. We've gathered tonight because many measures to protect residents and staff are still not in place, and it's time for our elected leaders to take action. We encourage everyone on this call to write your legislators and the governor and urge them to take action now. You can contact your legislators and the governor, and we'll be mentioning this throughout the evening, by visiting aarp.org/saveourseniors. On this site, you'll be able to find our action page, which allows you to email your legislators directly about the issue. All you need to do is enter your name, email, and address. Again, that's aarp.org/saveourseniors. Tonight, you'll hear from AARP's Vice President of State Advocacy and Strategy Integration, or as we like to say, SASSY, Elaine Ryan, who leads AARP's work fighting for you and your loved ones nationwide. You'll also hear from Lori Fasciarosa Brewer, New Jersey's long-term care ombudswoman, who is an independent advocate for older individuals receiving long-term care and has been on the front lines here in New Jersey every day. And we most importantly want to hear from you. We have heard from thousands of families about what's happening to their loved ones in nursing homes and other long-term care facilities. And you know it more than we do, the accounts are gut-wrenching. This is an opportunity to share your personal story, your personal experience, and hear from others and use your voice to demand change. If you have a personal story that you'd like to share live on this call about a loved one in a nursing home or long-term care facility during this coronavirus pandemic, please type your story in a few sentences into the chat box. The chat is not visible to everyone on the call. It's being monitored by our staff. Please type your personal story directly to Crystal McDonald, AARP New Jersey's Associate State Director of Advocacy. Crystal is leading our state's long-term care advocacy efforts and will be monitoring the chat tonight and working with me to take your personal stories and questions live. We do ask that you not mention the name of any specific facility, as this is an issue across the entire state. If you have a question, you can type in the chat directly to India Hayes-Larrier, our Associate State Director, and Usfa Rizzi, our Advocacy Intern. You'll see their names, India and Usfa, in the chat box. We will do our best to take your story and our question live tonight. Next slide, Larry. This, in one slide, is the tragedy we are facing here in New Jersey. New Jersey has more deaths from COVID-19 in long-term care facilities, sadly, of any state in the nation. There have been more than 7,000 long-term care facility resident and staff deaths in New Jersey, and more than 37,000 combined resident and staff cases of infection. This is a tragedy. Nursing homes have 1% of New Jersey's population, but 43% of our state's coronavirus deaths. And the toll has been enormous. The stories are heartbreaking. Our veterans' homes have been devastated. In nursing homes, as in the wider community, minorities have been hit hardest by COVID. Nursing homes serving mostly minority populations are twice as likely to experience a deadly coronavirus outbreak as those with mostly white residents, according to one study several months ago on the devastating impact of this highly contagious illness and its devastation on vulnerable residential care facilities. So it's time to take action. It's beyond time to take action. And we call on our state lawmakers to protect our loved ones in nursing homes, in assisted living facilities, and other long-term care settings, and at home, where so many are recovering from COVID-19. We know we can save lives. We know that there are things that we need to do, and there is an urgent need to get this done now. At AARP, we are fighting for the regular, ongoing testing and adequate personnel protective equipment for all long-term care residents and staff. We need transparency through daily public reporting of cases and deaths in facilities. We also need communications with families about discharges and transfers and funding accountability. We must require facilities to provide and facilitate virtual isolation, virtual visitation to combat the second devastating impact of COVID-19, which is social isolation. We must ensure better care for residents through adequate staffing and in-person access to our long-term care ombudswoman, and reject the sweeping immunity for nursing homes and other long-term care facilities related to COVID-19. Earlier this month, the New Jersey legislature introduced a package of bills that will protect residents in long-term care facilities and save lives. The package of bills will create certain preparation and response requirements for these facilities that are needed now, revise reporting requirements, provide adequate levels of PPE and regular testing, impose penalties on facilities that aren't doing their job, and require virtual visitation during lockdown. For staff at these facilities, the bills would allow employees to accrue paid sick leave, improve what are now very low wages, and provide supplemental payments to staff who provide direct care during the COVID-19 pandemic, essentially hazard pay. There is also legislation to establish a task force to begin to reimagine and put in place a better system for long-term care. A number of these bills are up for a vote tomorrow in our state Senate and Assembly, including one that will strengthen facilities requirements to communicate with residents and families and provide virtual visitation when we are not allowed to visit our loved ones. You can learn more about them on our website. Visit aarp.org/saveourseniors. As I mentioned, AARP is supporting this package of bills, and we know your voice is powerful. Again, send an email to your legislators. Send an email to the governor, urging them to pass this legislation and to pass this legislation now. So now it's my honor and privilege to turn the mic over to Elaine Ryan, Vice President of State Advocacy and Strategy Integration for AARP. Elaine is a smart and fierce fighter for all of us and knows from personal experience exactly what family caregivers face and the support we all need. Elaine is part of AARP's senior leadership team steering our nationwide campaign to both fix and reform our system of long-term care. To put it simply, we're in good hands when Elaine is around. Elaine's record of accomplishment is simply stellar. During her career, Elaine has been involved in the enactment and implementation of such important laws as the Children's Health Insurance Program, the Medicare Modernization Act, the Ticket to Work Act for persons with disabilities, the McKinney-Vento Education of Homeless Children and Youth, and the creation of the first Federal Office of Women's Health Research. In addition, Elaine has been instrumental in pushing through the AARP's Caregiver Advise, Record, Enable, or CARE Act. Under this law, caregivers are finally getting the recognition they need as the member of a patient's health team in the hospital. And before a hospital can release a patient, it must first identify a family caregiver and educate them on the medical tasks necessary to properly care for the patient at home. Elaine is here to discuss how COVID-19 has impacted nursing homes across the country and how AARP is fighting for you and your loved ones. Elaine, thanks so much for being here tonight.
Ev, thank you so much. And once again, New Jersey is the first to convene such a virtual rally. So I just want to thank everyone for joining today and also for your leadership in putting this together. Look, in my lifetime, I have never seen something more tragic and more compelling than the loss of life to COVID-19 in nursing homes. Just to put it in perspective, 170 100,000 people have died in this country. 70,000 of them were living in nursing homes or working in nursing homes. We don't have to go very far to say that if a state wants to target places of highest need, they need to start with nursing homes and assisted living facilities. I also just want to say a couple of things before I get started, and I have 5 minutes to get this all out, so I'll adhere to that time frame. But I do want to say one thing. I was a family caregiver for my mom and pop for 15 years. I've seen them go in and out of rehabilitation facilities throughout their health journey. And as you well know, that there are two kinds of people who actually live and are served by nursing homes. One are long-term residents, and the other are short-term rehab residents. So consider this, while you may or may not have a loved one in a facility today, consider the fact that as elective surgeries continue to open up, where do they discharge you? They discharge you to a nursing home that operates rehab. So everyone has an interest in making sure those facilities are as safe as they can be for people living in them today and for future patients that will seek rehabilitative services. And our record across the country is not stellar at all. New Jersey may have the most cases, but consider the fact that around the world, people living in care homes are the largest group of people who have been killed by COVID. And it didn't have to be this way. I think all of us can appreciate that early on in the pandemic, the focus was squarely on hospitals. People have never seen a pandemic in our lifetime. People weren't prepared for things. But today is almost 5.5 months later since the first death in a nursing home in this country. We need to do better. We can do better with simple things that AARP is advocating for across the country. Transparency, why? Because you need to know what's going on in those facilities, and you need to know the state of your loved one's health in those facilities. Testing, because people can be COVID positive or asymptomatic, but we need to stem the tide of the pandemic in nursing homes through testing. Personal protective equipment. Imagine that people in Indiana, workers, are being given one mask for a month of work in a nursing home. We have got to do better than that. Inspection control, inspection of facilities, virtual visitation. If it's not safe enough for you to visit your loved one, you need to be in contact with that loved one. AARP is fighting across this country for those kinds of protections. And I will say this, we've learned a few things during this time about facilities in states that were more vulnerable to COVID in nursing homes than others. And they shouldn't be a surprise to you. But facilities that had a greater number of staff did better during this pandemic. Nursing home facilities who had nurses in those facilities, hard to say, but many don't, actually had fewer deaths to COVID. Worker pay is critical at a time because workers not only work in one facility, they often have to work in 2 or 3 facilities to make ends meet. So imagine during the pandemic when a worker was perhaps asymptomatic going into a nursing home, they may have carried that COVID virus to 2 or 3 of facilities in a given day. And given the staffing standards are so low, they might be coming in contact with 100 or more individuals in a given workday. That is a dangerous way. And that's a dangerous way that the virus spread throughout this country. We also know the incidence of people who live in shared rooms. When you have a shared nursing home room, in some places across the country, it's not only 2 people who share a room, it can be up to 4 people who share a room. So imagine a pandemic when one person is infected, how quickly that spreads throughout a facility. We have to do better. We know what works. And what we have to do is remember the family caregivers who are renting cherry pickers in certain states to hoist themselves up to the second floor to check to see if their loved one is okay. In a country that spends $3.6 trillion on our healthcare system, we've got to do better than families renting cherry pickers to check on their loved ones. And I do want to, as I'm closing here, I want to give a shout out to the workers in those nursing home and assisted living facilities. God bless them for showing up every day at their own personal peril. They showed up not because they were making a boatload of money. They were showing up because of their commitment to the loved ones in those facilities. We need to do right by them. And if we don't, and we prepare for what could be an outbreak of a flu pandemic on top of the coronavirus pandemic in the fall, we have no one to fault but ourselves. Please take action. Thanks, Ev.
Thank you, Elaine. Thank you for those remarks. I'm sure there is a virtual cheer from our rally around the state for the work that you're doing all across the country. As you've heard, the lives of our nursing home residents and staff are at serious risk across the country, but with bold action, New Jersey can become a leader in ensuring the safety and dignity of aging adults in our state. Before I turn it over to our next speaker, I just want to remind everyone to visit aarp.org/saveourseniors, where you can write to your elected representatives and tell them to take action now. Take action now to save lives at aarp.org/saveourseniors. And again, if you have a personal story that you would like to share or a question that you would like to ask, please type your story in a few sentences into the chat box to Crystal. As this is an issue across the state, we also request that you not mention the name of any specific facility. And if you have a question, type that in the chat directly to India or USFA. We will do our best to take your story and your questions live tonight. Now I'm going to turn it over to a fabulous advocate, Lori Fasciarosa Brewer, New Jersey's long-term care ombudswoman, who has been, as I said, on the front lines every day, probably every night, who will discuss what's happening in long-term care facilities in New Jersey. Lori was named the New Jersey Long-Term Care Ombudsman by Governor Phil Murphy in March 2019. In this capacity, she heads the New Jersey office of the state long-term care ombudsman, which advocates for residents of long-term care facilities over the age of 60 by investigating allegations of abuse, neglect, and exploitation. Prior to being appointed ombudswoman, Lori served as the chief of staff to the long-term care ombudsman from 2010 to 2019. In that capacity, she oversaw a dramatic increase in the volunteer advocate program, instituted a triage system for complaint intake that dramatically reduced response times, and submitted a successful proposal to the Federal Centers for Medicare and Medicaid Services, or CMS, to include the long-term care ombudsman as part of the state's Money Follows the Person demonstration project, which is designed to facilitate community transitions, or in other words, help people move out of nursing homes. A former newspaper reporter and elected public official who has more than 20 years of experience in the government and nonprofit sectors, Lori has served in several senior management positions in New Jersey state government, including the Director of Communications for the New Jersey Department of the Public Advocate, Director of Public Affairs for the New Jersey Department of Human Services, and Deputy Project Manager for Healthcare Reform in the Department of Human Services, Division of Medical and Health Services, or Medicaid. A graduate of Rowan, Lori worked as a reporter for the Gloucester County Times and the Trenton Times before moving to the public sector. Lori, once again, thank you so much for everything that you are doing, for the fight that you are making, and for being with us tonight. Lori? There you are. Muted.
I'm sorry about that. Thank
There
you.
you go.
Can everybody hear me now? My name is Laurie Fetchiorosa Brewer. Thank you for that wonderful introduction. I'm going to have to shorten my bio. That must have been on the website somewhere. But thank you so much, Elaine. Thank you so much for the team at AARP. I love working with Ev. She's a fabulous advocate. You know, this has been an absolutely awful time for long-term care, as Elaine said, and we mourn the thousands of souls who have been lost. That's staff and residents of long-term care. It is just a staggering tragedy beyond belief. There's no other way to look at it. But through this terrible ordeal, some positive things have to happen. And those of us who have been in advocacy positions in long-term care have been pushing for a long time for some of the things that we see in this legislation. There's a couple of things missing that we'd like to see. I think Ev would agree. But for the most part, the types of things that we are looking for, building up the infrastructure in long-term care, I think we will probably see staffing ratios, rewarding the direct care workers for their work, compensating them, giving them sick time, that type of thing. We don't want people who are sick going into the long-term care facilities, right? So if you have sick time, you're not going to be doing that. Better oversight of the for-profit nursing homes whose finances are opaque, whose ownership is often opaque. Some of whose owners have a relatively, shall we say, shaky or shady past. So there's a number of things. The state of New Jersey, when it hired the Minot Group, who were the consultants who evaluated the New Jersey system and made recommendations for the short term and the long term, they talked to advocates like those of us in the Long-Term Care Ombudsman Office. They spoke to AARP, Disability Rights New Jersey, New Jersey Foundation for Aging, Goals of Care Coalition. They talked to the very small universe of advocates who advocate for people in long-term care. And they listened to us and they translated that into recommendations along the lines of what I just discussed and that are reflected in this package of 12 bills. And I think that's really, really a positive step. I'm happy to see the reform. Out of this terrible situation, maybe some good will come, but it will only come if legislators hear from you and you tell them this needs to happen. This bill needs to be posted. Each and every one of these 12 bills needs support. And so I strongly support this legislation, and it's one of the very few good things that has happened out of this whole thing. To give you some quick background on us, we are an independent state agency. I'm going to make the pitch I always make when I get an opportunity, and I'm going to tell you that we do a lot of our work with volunteers, very much like the wonderful volunteers from AARP who are helping us out today. We have 200 volunteers who are assigned to 200 facilities in the state of New Jersey, and my volunteers are in there every day, even now during this lockdown, making phone calls, delivering packages, doing virtual tablet visits with the people that they know in those long-term care facilities. And if you are interested in being one of those volunteers, I strongly urge you to call 609-826-5053. You will undergo 36 hours of training. Much of that training now, because of the world of COVID, much of that training now is going to be online. And after 36 hours of training and some additional classroom work, you will be assigned to a long-term care facility. And if you have to do your work in a virtual way, well, for a little while until we get through this terrible ordeal, so be it. But we still need volunteers. And so I urge you to call that number. One of the big issues that's going on right now is that families and friends and caregivers are clamoring to get back into the long-term care facilities. We have been on lockdown since March 16th. it's going to be, math, not my strong suit, 5.5 months of not seeing their loved ones in person. Happily, the state of New Jersey is a little bit above the curve in terms of what they're allowing, okay? So there are some states that don't allow outdoor visits at all. New Jersey has been doing that since June 21st. The issue there is that some facilities are doing a great job of it, and they're putting up tents, and they have fans, and they have water bottles, and they have multiple families visiting at one time. And then you have other long-term care facilities that are sticking people next to the air conditioning unit with like a little table in the heat near a roadway where you can't hear anything. So outdoor visits are far from optimal for an elderly individual who may have hearing or visual deficits anyway, right? And when everybody's wearing a mask, add to that. But it's something, and we've been doing that since June 21st. I'm going to say 2 weeks ago, the Department of Health, at the urging of a lot of families and a lot of advocates, and I think you're going to hear from another of those strong advocates, I hope, today, we have been pushing for visits that would be called essential caregiver visits or compassionate care visits, right? So since March 16th, the only visits that have been allowed are at the very end of life. And what the Department of Health has said now is that you can also have compassionate care visits. That's someone who maybe isn't on hospice, isn't at end of life, but who has had a serious decline, sharp decline in their condition. You can have a compassionate care visit, obviously with the proper PPE and all those types of things. But that's one of the things they're allowing. The other thing that they're allowing is called an essential caregiver. So this is really wonderful idea that you would identify someone who was either actively engaged with or participated in assisting in activities of daily living, like bathing, queuing, toileting, that you're willing to participate and do those types of things. Now, it is or, okay? So it is was actively engaged with the resident or will participate in assisting with the activities of daily living. So if you were someone who was actively engaged with the resident ahead of time in a long-term care facility, assisted living, nursing home, residential health facility, dementia care home, even if you weren't like helping them to assist them in transfers or ADLs, you still are eligible to be considered an essential caregiver. The issue here is that this guidance has been given, but there's so much subjectivity to it, right? So the long-term care facilities are being asked to develop policies that would allow essential caregivers to come in, and they can come in once a week for 2 hours, but they have to be designated as an essential caregiver. And that's where it becomes very subjective. That's where there's a lot of discretion. And so we in the Office of the Long-Term Care Ombudsman, our advocacy position is every family member who was previously and is still visiting their loved one in a long-term care facility is essential, because not everything is about moving someone out of bed or to the toilet or queuing or feeding. Sometimes you are there to hold their hand, to stroke their face, to do hand care, to have that physical contact with a mask on that makes that person feel better. We know the adverse effects of social isolation and loneliness are extensive. Everything from increased incidence of or poorer outcomes of heart disease, depression. People are basically saying that they don't want to live anymore. I mean, we're getting those calls. Families are getting those calls. So, you know, I think I want to credit the New Jersey Department of Health for including the essential caregiver, and I give a lot of credit to the providers who have already come up with policies to allow people to come in, but there are still quite a few other long-term care facilities that have said no to families. We don't think you're essential, and I think that's a problem, and I think it leaves far too much discretion up to the long-term care facilities. I think if you're a family member who consistently visits, who has stayed in touch with your loved one, that you should be essential. And every resident of long-term care who wants one should be able to have someone designated as an essential caregiver who will come in once a week. So that's what we're pushing for now. I'm part of a national organization of ombudsmen. That is the feedback that we're giving to the federal CMS, which is revisiting and re-looking at their guidance on visitation. And we are saying you really need to make this simpler. Everybody needs to be able to have at least one person who can come in once a week and see them. And nobody wants people stampeding into the long-term care facility, right? But New Jersey right now, most facilities are required to have at least a month or 2 months supply of personal protection equipment, access to testing. They are working on outbreak plans, and staffing plans, and all of those sorts of things. And they need to really focus on the emotional, mental well-being of the long-term care residents. I know I'm talking too long, but I do want to say one of the other positive things that happened, I hope that you will hear from someone today from Face for Seniors, which is a very strong Facebook page and whose members are really pushing for this type of essential caregiver designation that I'm talking about, but they're also talking about other care issues in long-term care. Another positive thing is that families are becoming advocates as a result of this. And we need more advocates in the long-term care space. We need more families. We need more residents. I hope there are residents on this call. We absolutely want to hear from you. We need residents and families to be out there to balance the voices of the long-term care industry, who are always talking to our state legislators and always providing input. And we need to balance that. So thank you so much for the opportunity to speak. I really appreciate it. Some resources for families who may be listening also are the National Consumer Voice. And the other thing that families and residents can both do is you can start a family council or a resident council in your long-term care facility. And even if you're not in there, you can do it virtually. And there's information about that on the National Consumer Voice website. Thank you so much.
Thank you, Lori. Thank you for everything that you do. Thank you for the fight that you take up every day. So many of the stories and the folks that you work with are so lucky to have you and to have you at their back. And as Lori mentioned, we now want to hear from some of you who are here tonight at our rally. Just again, if Crystal asks you in our chat box to take you live, you'll receive a notice to unmute yourself. Please just click unmute, then share your story live on the call. We'd love to hear from you, and we appreciate so much your sharing. Before I take our first caller, again, I just want to urge everyone to visit aarp.org/saveourseniors. We need our legislators to pass this package of bills now. You'll find a link on our page where you can write to your representatives and tell them to enact these bills to improve the safety of long-term care facilities for the residents and the staff. Again, that's aarp.org/saveourseniors. Crystal, do we have a caller who's ready to share?
Yes, we do. Today we're going to be hearing first from Cynthia Waterman. Cynthia, you're going to receive a notice for me to unmute.
Done.
Cynthia, thank you so much for joining us.
Hi, how are you?
Good. How are you?
I'm good, thank you.
Good. So what's going on?
My ex-husband was in a nursing home. He's been in since 2014, but since COVID started, he was doing pretty well. He was basically healthy and things like that. I was very much involved in going to see him until the COVID started, but I would keep up on a regular basis with the phone calls in reference to his health and all that. The beginning of April, he was still doing fine. He passed away on April 13th of this year.
So sorry.
Thank you. Around the 10th of April, I was asking them questions if there was anyone on the floor who had anything, and their answer was, well, it hasn't been fun. I said, is he segregated from people that have it? And they wouldn't answer. When I called in 2 days later, they said he was running slight fevers. Then on April 13th, I got a phone call he expired.
Wow, so sorry.
Thank you. At the end of all this, after he expired, they actually lost his body. It took a couple of days for them to figure out where he was. So it's not a good story.
No,
you know,
it is.
I'm so devastated, but I try to go on, and I really appreciate AARP doing something like this, because as you have said, people need to hear these kind of stories. I mean, you know, and they stated they were understaffed when I asked them to check on them. We can't watch everyone. You know, we're understaffed. That's the answers I was getting. And then he was gone. So
We are so sorry. Our thoughts, our prayers, our hearts go out to you and to your family.
thank you.
And please, of course, let us know if there's anything that we can do. And again, your story is such a vivid example of why we need to do better, why we can, and we know we can do better. And that's why we're calling our legislators to act now.
Yes.
And make sure that we have the staff, that we have the equipment, that we have the accountability that we need to ensure stories like yours never happen again. So thank you so much.
You're very welcome.
Crystal, do we have anyone else who would like to share a story?
Yes, next we have Diane Snyder, who's going to be sharing her experience.
Yes, good evening. Can you hear me?
Good evening, Diane. We can. Welcome. Can you hear us, Diane? Diane, we can't hear you. Maybe you're on mute.
Can you hear me now?
Yes, we can.
Am I echoing on your end? I'm sorry.
A little bit, but why don't you go ahead? We
I
can hear
will.
you.
Thank you. So my story is about 3 years ago, both my parents were living. My mother and father were in their 80s. My mother started to fall ill from some spinal stenosis. They lived independently. 2 years ago, in fact, this week, my father passed. And right after that, my mother, being married 60 years, got depressed. She started to get sick. Right after Thanksgiving 2 years ago, she was in the hospital and never went home. So she went from the hospital to rehab, and she became very, very frail. I wasn't sure that the facility that we had selected to put her into would even have taken her at that point. But January 1st of last year, they accepted her in. And like I said, she was very frail, but within 6 months, and she previously was walking with a walker, but now she was wheelchair bound. She was back to using a walker on occasion, that minimal exercise of moving around in a wheelchair, the interaction with the other residents playing bingo. I never knew my mom would be such a bingo fan. Really revitalized my mother. And up until COVID, she was doing fantastic. And I have to say that the facility she is in, I believe, has done a tremendous, tremendous job. The problem that I see now is I remind myself every day that I can go to the grocery store. I can go walk around the block. And I'm treating COVID pretty conservatively, but she is in her 4-room, she's in between, she's in her box. They have limited facilities. They do have outdoor visits. I had one with her today. But what I've begun to notice is up until my first outdoor visit, one of the things I had done when I'm her caregiver, I'm sorry, I should have said that. I do her finances, I do her medications. She ended up in the hospital because she had a chronic congestive heart failure and she was swelling. So I monitor and measure her ankles and her calves once a week, and I'm there multiple times a week to see her. With COVID, there was nobody doing that. When I first saw her outside, I had noticed she had gained weight from the food they were feeding her because of having to put things in bags and simple things. She's definitely looked more frail and she was very tired. But over the last 2 months in particular, I've noticed a lot of agitation. She's just done, like many of us, but the agitation, the lack of the social connectivity. She's a very social person. The weight gain has impacted her health, and she is now not even able to walk and move around as much as she was previously, although PT did start back up. I've also noticed, so she's starting to be getting depressed as well. We are now measuring her ankles when I visit her each week. I have scheduled outdoor visits, and she is swelling, and she is, you know, not gaining weight, but retaining some water, which could be very serious. But a couple of other things I wanted to mention that are, you know, not related to the essential caregiver, but I did, because I did ask the facility about that, and they don't know what to do with it. One of the leaders wasn't even aware of it. So luckily I was able to tell her what page it was on in the Murphy's directive. And the other, you know, they're very concerned about doing the right thing. And like I said, they have done a really amazing job there. I'd rather they be a little more conservative, but there was like no light at the end of the tunnel for her. The other things that I noticed is, you know, it's like forgetting that a lot of these elderly people have hearing aids. When they knock on her door to see if she wants to go outside, she doesn't hear them, so they walk away. And they're busy, I get it, right? I mean, I totally empathize with all those staffers, and God bless them all. The ever-changing rules, particularly early on, of what they could and couldn't do, she's got short-term memory issues. She remembers stuff from 20 years ago, but not from 2 days ago. So as rules keep changing, she ended up just kind of becoming paralyzed and just staying in a room because she didn't think she could do anything else.
Wow.
It's a constant communication with the facility to find out, you know, can she do this, can she do that? But it's a decline in the last few months as I look forward into the winter. Outdoor visits, what are they going to do when it gets colder, right, in the state, and all those things. So thank you for doing everything that you are all doing, and I look forward to hopefully some progress.
Diane, thanks so much for sharing your story. Our best to you, our best to your mom. You may want to follow up with Lori's office, who can perhaps help you with educating that facility about what their obligations and responsibilities are right now. We will be providing that number to all of our attendees tonight. We'll throw up a slide, we'll put it in the chat box, and we'll also be emailing out this information to everyone who attends tonight. But Diane, thank you so much. Thank you for all that you are doing. I think your story just exemplifies how important it is for family caregivers, for loved ones of residents in nursing homes, to be able to get in there and to be able to just monitor what's going on. You more than anyone else know when her ankles are swelling, when she's putting on weight, when she needs to have her hearing aids in, because as you say, we don't have enough staff there now. And it was even worse during the worst stages of the pandemic. So thank you, Diane. Hang in there. We'll give you all the help we can, and call your legislators and tell them to pass these bills. So I know so many people have stories to share. Crystal, do we have someone else waiting here to share?
Next, we're going to invite Bill Burrell, who's going to go live. Bill.
Hi there. Hi, everyone. You know, these stories are so sad to hear, and just hearing too. But in some ways, I'm grateful to the AARP for putting this together, because it's kind of healing just to know that there's so many family members out there that just want to do the right thing for their loved ones and are having such a hard time doing it. So I wanted to say thank you to Elaine, who spoke earlier. And I like the fact that she said that she was a family caregiver, because I believe that when people have been through this experience, they have a certain empathy and understanding that others don't. And so I value that in people that have been through it. And I also like that she distinguished long-term versus short-term care, because it's a big difference. And then it's great to meet Lori Facciarosa Brewer sort of in person, because she has been my advocate. She oriented me into this space in trying to become an advocate. And I only hope that I can do as much good as she does for all of us. My mother's name is Rose. She's 94 years old. She lives in southern New Jersey in assisted living. She moved into assisted living for two reasons. One, she's legally blind. And the second reason is for the social interaction. She's a very social person. She is physically, very good. So she falls in sort of a different category than the two earlier examples. My brother and I, along with many family members, supplement the care that's provided to her by her facility. We divide up the days, we divide up the tasks, and it's all the things that you have heard about, cleaning out her hearing aids, which wax up. She uses a voice-activated phone because that's her only connection to the outside world, and it malfunctions. Clothing, her refrigerator, we like to bring her food that she likes because when she looks into the refrigerator, it's just a blur. But we actually organize it for her, and her hair and her nails, and on and on and on. So we supplement as essential caregivers. Now, I saw her for the first time after many months on June the 20th, which was the first day that I could do an outside visit. Now, I talk to my mother all the time, but when I saw her, I could see how much she changed. And physically, she looked different. In my case, versus the other example, it was weight loss. And it was more confusion and more sadness. And her personality is what distinguishes her normally. And she lost her perkiness. So I sort of didn't recognize her. And that was when I realized I need to do something. So I did write the Ombudsman. I did connect with Ev. I wrote everyone I could, including the New Jersey Department of Health. And in my sort of crazy but passionate letter writing, I did hear back from the Department of Health. And I think I was able to make a case that there are these people called family, and we do provide essential care. And so I would say that I formed the Facebook group Face for Seniors, primarily because at first I just wanted to know if there were other families in the same situation. And what I learned from this simple idea is that there are hundreds, at least there are hundreds within the group, and there's hundreds more. And I think people value just sharing what they're going through. And maybe what I can try to do is give them a voice, and that's what this rally is trying to do. Give these people a voice in their love for their family. And it's starting to happen. I would say one thing, I think there's a lot of either or thinking. Either we shut down and everybody's safe and great, or we open up and COVID breaks in and the world is a disaster. And you know what? There's something in the middle, and that takes planning and thought. And that's what the directive to me that came out on the 10th of August was about. It's about visitation, but careful phased planning to let family members back in. The problem is it's not being implemented consistently. I think there's some fear about letting family in, letting visitors in because of the experience of what has happened. And that's getting in the way of us taking care of our family. And it's also getting in the way of these residents having a sense of love and belonging. The isolation is doing damage. We all know that isolation can lead to death too. So it's time to kind of come back a little bit, very conservative, understand why. We love our loved ones, we want them to live, but we want them to have quality of life. And my mother went into her facility for the social aspects, which have been zero for almost 6 months. And you know what? In September, the beginning of September, we're gonna reach 6 months. So I think the directive needs to be implemented faster. I think that the effects of isolation are starting to be understood better. And I say, let us in, let our love in, and let us love those that we love. All right, thank you.
Thank you, Bill. Thank you for everything that you're doing. Our best to you, our best to Rose. And, it's just fantastic to hear about your Facebook group. Please encourage all of your Facebook friends, not just you, but everybody at the rally tonight, to go to aarp.org/saveourseniors and contact our legislators to fix our nursing homes now and to change our long-term care system for the future. We are getting close to the hour. I know we have some questions about what the legislation will do. Are we better prepared if we reach a surge, if we have another surge in the fall. So I just want to say a few things, and then I think we're going to try and squeeze in one more rally participant. But the legislation would do a number of things that would fix nursing homes now and in anticipation of a surge. One would establish a new Office of Emergency Management for long-term care facilities in New Jersey that would coordinate and prioritize personal protective equipment and the regular testing of residents and staff. In the early days of the pandemic here in New Jersey, it was awful, but long-term care facilities were literally not on the list for PPE and testing as the virus was raging through our nursing homes. The Office of Emergency Management, which is up for a vote tomorrow, would hopefully fix that. New Jersey has been stockpiling PPE and tests. We're in much, much better shape than we were. And it's so important that those supplies get the priority designations they need for our long-term care facilities. Other legislation that's up for a vote tomorrow would increase by $3 an hour the minimum wage for our direct care workers in New Jersey's nursing homes. They are sorely underpaid for the work that they do, often the most backbreaking work that you can do in a long-term care facility. And we need to improve their wages. There's also another piece of legislation that's up for a vote in the state Senate tomorrow that would, perhaps you don't know it, but there are many staff people in nursing homes who don't get any paid sick time themselves. And so there is a bill that's up tomorrow that would require nursing home staff, particularly frontline staff, have access to paid sick days. There's a bill up tomorrow in the Senate that would improve communications between families and residents and facilities. I'm sure many of us who are attending tonight had the more than frustrating experience of trying to call the facilities and nobody would literally answer the phone. This legislation would fix that, and it would also require, it would mandate virtual visitation during periods of lockdown when, for public health reasons, visitation is prohibited. There's also legislation that would establish a long-term care task force that will focus on rebalancing our system so that we can put more resources into home and community-based supports so that folks have more choices and better options to live at home and in their communities where they want to be. And there's more, and you can find out more information about all of these pieces of legislation and how to contact your legislators and to urge them to enact these bills now. And let me now go to Crystal again. Crystal, do we have, I think we're going to try and bring one more person into the rally to share a story. Crystal?
Yes, we're going to be inviting one more person in a moment. I just want to say we've also been getting questions about whether folks will get an update on how the bills do in the State House tomorrow. And yes, we will send an email update out about that.
Yes, we will.
And now I'd like to kick it over to Yvette. Yvette, you're live.
Oh, okay.
Hi, Yvette. Welcome.
Hi. All of a sudden I can't see myself. Let me see here if I can get it back here. Yeah. Well, geez, I don't even know what to say.
That's okay. Take your time.
Yeah, I'm going to try to stay calm. My mother was in a nursing home for the past 5 years. Back in May, she got the virus and she passed away.
So sorry.
Thank you. I hadn't seen my mom since, wow. I had to have a procedure done in March, on March 9th, which was on a Monday. So I said, I will go and see my mother on March 8th, which was Sunday. That's the last time I saw her.
So sorry.
Thank you. On March 12th is when it was all over the news, and they were saying, everything is on lockdown now. You have to shelter in place. And I think like the very next day, her facility locked down, and I was told because of my surgery I could not go, and I could not drive for 2 weeks. But I really, if they had not locked down, I would have gone to visit her that week when, before they closed. But, speaking of, not being able to talk with her, or well, she didn't speak, but she was nonverbal, and she had dementia. I could not reach the facility for I don't know how long. I mean, just before she died, like about a week before she died. I remember it was on a Saturday. I called, no lie, I marked it down 13 times that day.
Wow.
And finally, on the 13th call, I got someone, and as a matter of fact, it happened to be the wing that I was trying to reach. I reached her nurse, and he said, it's a male nurse, that she was eating most of her food. And then, she was doing good. Excuse me. And then a few days later, on Tuesday, I get a call from one of the nurses of her insurance that says, what would you like for us to do? If she goes to the hospital, they will do CPR on her, which, I didn't have a DNR on her, do not resuscitate. And they said if they do that, then, they may crack her ribs. She's so frail, and they kept emphasizing how frail she was. She had been losing weight steadily for the last several years anyway, and I had always had an issue with that and always brought that up in meetings. But now, when she had the virus, because she was asymptomatic at first for about a week, and then after that, they're like, oh no, your mom has the virus now. So when they called me, like I'm not good at math either, Saturday, Sunday, Monday, Tuesday, 3 days later, to say, oh, what do you want us to do? And I'm like, what are you talking about? What do you, oh, we're ordering fluids for your mother because, she's very frail. She's very frail. And do you want us to do CPR? I'm saying constantly, what are you talking about? She was fine Saturday. They're like, oh, well, it doesn't look good, blah, 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 blah. And they're going through all this stuff. So then, just to make a long story short, I said, well, fine, get fluids, do that. And they let me see her a few times before that with FaceTime. And this time they let me see her. And she had trouble breathing. She was not well. And yeah, so 2 days later, she died. And, I'm so angry. I'm very angry because, I had talked to my mom's roommate. She was asymptomatic as well, but she never did get sick. And I told her, I said, do you know that my mom has the virus? And this was like in the very beginning. And she's like, no. And this was 2 days after they told me. And I said, they didn't tell you? And she said, no. I said, you make sure you tell them that I told you she has it and you want to be moved. Because I believe that's how the roommate got it as well. So they moved the roommate like 2 days after that. So she was in the room with my mom for 4 days. And, and she always was hugging my mom and was talking to her and trying to comfort her and saying how I couldn't come and see her and I would see her after this whole thing had passed. But, that never happened. But, I was so angry at that nursing home. And I heard directly from the roommate and other people who worked there, but are very afraid to come forward. saying that they never used any PPE. When they found out a person, one of the residents had the virus, they moved them without any masks, without gloves, without gowns, nothing. And I do believe that's how it spread to my mom, because it was not in her wing. It was at another wing. And then about 2 weeks later is when she got it. So, you know, I contacted 2 lawyers. They're like, no, I'm sorry. You know, they have this protection. You cannot sue them unless you can prove egregious neglect. Well, when this whole thing started, the facility shut down and you could hardly get in touch with them. I couldn't talk to anyone about it hardly. And, you know, and then they were very vague at that. So I don't know what to do. I would love to do something. I'm still very angry and holding on to that anger, which is probably why I haven't really broken down completely about my mother's death. So I don't know if there's anything that I can do.
Well, Yvette, again, our heart goes out to you, to your family. Such tragic circumstances that she and you and your family found yourselves in. We have some numbers up on the screen. You may want to reach out to the New Jersey Attorney General, who is conducting a long-term care facility misconduct report. And we are angry too, and we are going to channel some of that anger into our advocacy efforts to rescind some of those sweeping immunity provisions that New Jersey enacted earlier this year, because they are too broad, and families like yourselves, and I'm sure like many others, need to be able to hold facilities accountable where they need to be, and if holding them accountable in the courts is the only access that you have, it's important that that be protected. So that is not in the package of bills tomorrow, and that have been introduced, but we have been working with legislators in the State House who are committed to trying to rescind those sweeping provisions. And I think that your story will be very helpful in helping to make that happen. So thank you so much for sharing. We have gone past an hour, and we're going to let everyone go, but rest assured that we will follow up. We will let everyone know what happens tomorrow, what's expected in the weeks ahead, and how you can be part of the change. So again, before we go, just please visit aarp.org/saveourseniors, write your legislators, urge them to pass these reforms now. I want to thank you all for being here tonight. Thank you, Elaine. Thank you, Lori. Thank you to those who shared your stories with us. And let me also thank our AARP volunteers, Michelle, Carol, Larry, Dan, and Roberta, who have helped put this Zoom rally together, and without whom it would never have happened. So thank you so much. Thank you all for everything that you do. Go to aarp.org, save our seniors, and we will save lives. Thank you and good night.